So I'm going to ask a few questions, and then if there's time, we'll open it up. So guys, thanks so much for being here. The first question I have is, a lot of people are trying to get away from the third-party payer system. So I think for me, what I'm trying to understand at a fundamental level, why is what you are doing different? And I guess, how is what you're doing not introducing a new third-party payer?
I guess the important thing about what we're doing is that there's not a third-party payer. Not to take the softball, but this is a plan for people to self-insure. And there's no middleman making decisions sitting in the middle of the transaction. There's no prior authorization. Insurance companies have two jobs. One is to move money around, and the other one is to cultivate enough trust that people believe that they can do it. They've sort of done the first one. They're getting really bad at the second one. And you don't have to do either of those jobs in the world we live in today with the technology that we have today. So there's no third party, so it's a different system.
You know, I would say it's, I can use the mic. I would say it's about our community approaches. People are coming together. We're not restricting their access. That's a key difference. So we're not getting involved, telling them, you know, we're not paying the physician. And that was very intentional for us, because if a DPC practice wants to charge $70 a month, or one wants to charge $90 a month for an individual because they're adding on services, who am I to tell them what to charge, right? That's for them. And so yes, you have a community behind you when you need them, and that's true. So you could say, well, that's sort of like a third party, but we try to minimize that as best we can.
Great, cool. Preaching to the converted, by the way. So Jamie, so we've been running a pilot for a few months now with Sedera. Can you talk a little bit about some of the learnings you've had from that experience and what, you know, some of the plans are on a go-forward basis?
Sure, thanks, Zach. We were excited. At the Hint Summit last year, we talked about this pilot project that we started with Hint, and it launched, I would say, late third quarter of last year, or right at the beginning of the fourth quarter of last year. And we've had a growing number of people who participated in that, and still are, and it's growing, and we've been excited to launch something as this pilot. But as pilots do, you learn some things. And if I could go back and wave the magic wand about, and I think, Zach, you feel the same way, is there are certain practices that love the way it's been implemented. There's some that don't. And just what we talked about, we don't want to get ourselves involved in the doctor-patient relationship or the business of the DPC practice. I don't want the physicians in this room and their practices to feel like they need to sell Sedera. That's not what this is about. We're an option amongst many. We'd love for you to put us on your website. We'd love for you to say, hey, go check out Sedera.com, but I don't want to get involved today. It's kind of coupled, it can be coupled into their sign-up process as an add-on, and I think that's what we've been talking about, is making it a little more loosely coupled where, hey, you sign up for the DPC practice, and then if you want Sedera, that's a separate thing. Go talk to Sedera about it. And by the way, if you do, you get credit because of your direct primary care practice. So I think it's an important shift, but it's been a great experience so far, and we look forward to getting that resolved.
Great. Hey, so Nick, one of the things you mentioned is I think it was 60-40 or 75-30-25 or something in terms of what.
To start.
Yeah, that was so. I guess the question is, what is it about your plan that resonated with people more than the big insurance startup? Can you sort of dive in? What were some of the key differences?
Yeah.
Use that one. Yep.
So the good news is we put out the same sort of sheet that insurance always uses to describe the different benefits, and we had a mild highlight on DPC, but not everybody knows what DPC means. So instead we said unlimited primary care in the form of DPC, and people got that. And that's a huge part of what they loved about our plan. And I think that probably is consistent with the experience of everybody in this room. When people understand what this is, they want it. Whether they want it because they think it's the future, whether they want it because they think it's the pastoral. I could say that as an English major. I get to throw those words in sometimes. Where you used to have a doctor who just took care of your whole family, which is what my parents were. It's what they want, and just figuring out how to talk about it in the right way took us a big big step. And honestly, I said I wasn't going to talk bad about anybody trying to provide affordable insurance for people, and I won't. But the folks that we were being compared to, I don't think that's the game they're playing. I think it's an app wrapper on an existing insurance company with all the same misaligned incentives. And what I know from talking to people in the market is people are tired of it. People are tired of hearing, yeah, we don't cover that. Yeah, we don't cover that. Sorry, I wanted to do that for you, but my insurance won't let me. So we had a little bit of an unfair advantage because we're starting clean. And so many of the folks out there now have fucked things up so bad. Also, I want to shout out my team because this classy guy did that and I didn't. Anybody who's wearing one of these shirts, red or black, raise your hand if you're part of the decent team. We all want to talk to you. Molly's the brains behind the operation.
Cool, great. So Jamie, so you've been now working with DPCs for what, a year? More than a year? What, approximately how long?
So we were working,
And
Jason...
actually, my follow-up question is, what is the impact that DPC is having on your population?
Appreciate the question. The first DPC practice that we started working with was one of our speakers today, Assurance Health in Yakima, Washington. And so I had the pleasure of working with Dr. Edgerly and Jason Larson, who's around here somewhere, and visiting with employers and up there and talking about, and really trying to understand how Sedera and DPC can work together. And so we've now had a growing group of members who have got direct primary care and then enters Hint. And so we've had a population of people working with direct primary care practices, giving them a discount on their membership fee because of that. Hint just makes it a whole lot easier and automates some things, which is, of course, we love that. So bottom line, that population's growing. We love it. We want to promote it. And I'll say this, we actually, our growing membership base, and we grew almost 4 times last year, we're just accelerating in the growth. We want to start sending our members who are not part of direct primary care to you. Now, why would we do that? Because you're going to take better care of them. Number 2, like I talked about earlier, you're educating them how to buy health care in a free market world. Now, the real answer is, what's the value to the community? And I think that's really your question. Preliminary data says, and we've got a lot more study that we need to do on it, is the savings is somewhere between 20 to 30% on the cost of shares for the community. That's why we give the discount.
Cool. So we've got time for one more question. Nick, the question I have for you is, you didn't mention this, I don't think, one time in your presentation today, but I'm aware of this. So there's, you're actually a blockchain startup, is my understanding, as well as an insurance, what are we going to call it? It's not insurance.
We help groups of people self-insure to save 20 to 30%.
Yeah, there we go, good. All right, that. But is the blockchain thing just a way to attract investors? Is it a sort of a buzzword? Is it a bunch of mumbo jumbo? Or is there something real there? Like, what? Talk to us a little bit about what you're thinking there, and
there's something real, and instead of boring everyone with 17 use cases and tokens and bullshit, I won't do that. Technology is changing. Technology, in my opinion, is only ever an enabler for user benefit. We're not a blockchain startup. We use blockchain and many other technologies to deliver value to patients. The simple way to think about this, I think, comes back to your last question and the role of a big incumbent insurance company these days. What are they doing? They're moving money around. They're taking a big old handful of it themselves, and they're supposed to represent trust and be trusted by the people that they serve. They've done a terrible job of the second one, which is why the Net Promoter Score of insurance is worse than anything in this country except Comcast. I literally looked that up. It's literally health insurance, then cable internet services, and everything else is better. Amazing. So they're not doing that part. Blockchain is a technology that is really good at moving money around. And in a unique way that I'm happy to yammer your ear off after this, it removes the requirement to trust these centralized third parties. All you have to trust is math in a transparent system with internet-grade security, and that's what it's doing. So fundamentally, and I'll bring Jamie into this too, they don't need to exist anymore. And I don't know if Decent's going to be the company that does it, but I fully expect that when we look back on this decade or this century and the sea changes that exist in healthcare, part of what we'll see is that people got wise and realized we don't have to be reliant on these blood-sucking vampires who take a big-ass cut and have nothing to do with compassionate patient care. If blockchain can help us get there, then great. If Decent can help us get there, then great.
Fantastic. Thanks so much. Awesome. Cool.